we also need to continue to put forth our efforts in reducing the risk of transmission within our community. Over the last 2 days, we have received many queries from members of the public on whether they can continue to gather in groups, meet friends, have a meal with friends or with family members. Let me explain. The key message is really stay at home. Go out only for essential activities, such as to buy food or seek urgent medical attention. Not to go and socialize, not to have parties, not to meet each other, not to meet friends. This is very important. And we understand that some may have elderly parents who live alone, and they need to visit them regularly in order to help them with their daily needs. This we will permit, but do try to reduce the interaction times as far as possible and observe strict personal hygiene. This is in order to protect them. And do so, visit them only when necessary and not so frequently, because we do need to protect our seniors. And for the same reason, we will also not allow parents to drop off their children with their grandparents on a daily basis. Because every time when you bring your children to your parents or to their grandparents, we expose them again and again to potential infection. So if there's care arrangement for the grandparents to look after your children, then you should leave the children with your grandparents throughout the entire circuit breaker period. This is to protect the seniors, to minimize the risk of exposure to virus attacks. I understand that some essential workers may have problems with this arrangement because both father and mother have to go out to work and the children have to leave it with their grandparents. If you are able to leave them with childcare services, do so. We have made childcare services available for essential service workers. And if not, there are no alternatives, appeal to us and we will consider on a case-by-case, but only for essential services workers and only when there are no alternatives. This is to ensure minimum exposure for our seniors to this COVID-19 virus. The elderly and are vulnerable and most susceptible to severe COVID-19 infection. We should refrain from exposing them to the risk of infection as far as possible by avoiding frequent contacts. Every time we visit them, we put them at risk. I know these measures are very painful, but they are necessary to protect our seniors. And we'll continue to monitor the situation, and from time to time, we may need to tighten the measures further. And we also need to step up our enforcement to ensure compliance with these social safe distancing measures.